Hello, everyone. Thank you for viewing my presentation about my employer, Spectrum Health. I hope you enjoy the presentation and I look forward to your questions and feedback. What is Spectrum Health? As you can see from this image, Spectrum Health encompasses a lot of downtown Grand Rapids. It is fortunate to have many specialties like the Helen DeVos Children's Hospital, the Fred and Lena Meyer Heart Center, the Lemon Holton Cancer Pavilion, and many other specialists that can help with the health of the West Michigan community. Spectrum Health is Kent County's largest employer with more than 30,000 employees, and this number increases on a daily basis. We have more than 3,700 physicians and advanced practice providers. Advanced practice providers are physician assistants, nurse practitioners. We have 14 hospitals spread throughout Western Michigan, as far north as Traverse City and as far south as the Lake Linda area. 225 ambulatory sites. Ambulatory sites would consist of physician offices, urgent care buildings, integrated care campuses, and so on. We provide more than $30 million in philanthropic support to the communities we serve in the last fiscal year. Spectrum Health is all about serving the community that they help care for. Spectrum Health's key to our success. We drive exceptional value. We provide safe and high-quality health care for the people we serve. We transform the care model. We design a model of care that is patient-centered, interdisciplinary, team-based, and time-sensitive. We understand what's important to patients and how timing on some types of illnesses can be of the utmost importance. We become more consumer-centric. We anticipate and honor our consumers' preferences. We optimize system strategies. We achieve system strategies and deliver the best value for our consumers. Grow with a purpose. Improve the health of the communities we serve through targeted growth. Spectrum Health is continuously growing by integrating with other health systems throughout the state. And we lead new health solutions. We create proactive and innovative health solutions that exceed the expectations of our consumers. Spectrum Health wants to be the premier healthcare system in this area. We target our growth and our patient care towards models such as the Mayo Clinic and the Cleveland Clinic. Ultimately, Spectrum Health wants to be the best in the area. Our culture, values, and behaviors. Excellence. We strive for the best outcomes and deliver exceptional experiences for our patients. We continuously push ourselves and go above expectations. We have to be flexible and embrace change by challenging the status quo, and we take smart risks to create positive outcomes. Accountability. Have an active approach to your work. Be an owner. Commit to getting the best results and focus on what is important. Make your work visible to others and think critically and view problems as opportunities. Be compassionate. Be passionate about those that we serve and put the patient first. Listen so you can better understand, anticipate, and navigate transitions and learn and grow from your mistakes. Integrity. Instill a climate of trust so others can count on you. Communicate candidly and directly. Be receptive and open to feedback. Be courageous and demonstrate commitment to what is right. Respect. Be open and accepting of differences. Treat others with dignity and courtesy. Appreciate the contributions made by others and show interest in working with others who have diverse ideas, experiences, and backgrounds. And teamwork. Celebrate the success of coordinated efforts and express gratitude and appreciation. Champion group decisions once they have been made and share information openly and proactively to make the organization better and inspire others with a positive attitude. This is the value and the behaviors that is instilled in every single Spectrum Health employee throughout the system, both within the hospital group and the medical group. In order to become that premier health system in this part of the country, it is important that we focus on these key behaviors on a daily basis. Spectrum Health mission and vision. Back in 2015, Spectrum Health sought their mission and vision and decided to label those to be to improve the health of the communities we serve. And by 2020, Spectrum Health will be the national leader for health, again, focusing on similar health systems like the Cleveland Clinic and Mayo Clinic. Spectrum Health wants to surpass those systems within the next year. It's a large task, but I believe we're up for it. The organizational structure of the system is twofold. Being that we're such a large health system, it is somewhat separated by the hospital division and the medical group division. The medical group would encompass physician practices, ambulatory care sites, things of that nature. And they somewhat follow the same chain. They're governed by a board of directors, and then the president and chief executive officer. Beneath them is the executive vice president and chief operating officer. There's a vice presidential team. There's 13 total within the organization, which then falls to operation directors, operations specialists, practice management, and then practice level employees. On the hospital side of the organization, it's slightly different. They still report to the president and chief executive officer and the executive vice president and chief operating officer, but then this is where it goes slightly different. There's a chief medical officer who is a physician within the organization. There are division chiefs for the separate divisions within the hospital, for example, surgery, oncology, the medical team. There's several different divisions within the organization, which then fall to section chiefs, physician site leaders, and then ultimately physicians who do not hold leadership level positions. Recently, the organization elected a new president and chief executive officer. The former president and chief executive officer, Rick Brion, retired after an 18-year tenure at the helm. Tina Friesdecker recently took her position on September 1st. In the past 16 years, she has held several different roles within the organization, most recently the chief operating officer and executive vice president. Focusing on leading Kent County's largest employer into the future is one of Tina's main goals, and it is noted that she was unanimously voted to be hired for her role by Spectrum Health's board of directors. How are teams and groups utilized? Teams and groups are utilized in every type of organization, as well as within the healthcare industry. Healthcare just has many different teams and groups which focus on specific tasks. For example, some teams within Spectrum Health are focused on infection control. They may focus their attention on instrument processing, hand washing, things of that nature, things that help keep our staff and patients safe. Process improvement is a huge focus within the organization. A lot of efforts gone into Kaizen culture training. Kaizen culture was first introduced within manufacturing within the Toyota industry. Kaizen culture focuses on managing daily improvements and focusing on change for the better. We do team huddles and have several different metrics in which each office needs to meet within its organization. The nurse educator team implements process changes to also aid in patient and staff safety, and the leadership team maintains the efficient operations of the practice. Those are just a few teams within the organization. Groups, on the other hand, are a little bit different. Groups within the practice that I work in, for example, we have a referrals management group. They manage access issues within the practice, appointment coordination, if the patient needs to come in and be seen by more than one provider within the office on the same day. We have also implemented what we call a culture group. We focus on improving the workplace culture, so focusing on things, staff issues, team bonding, process changes within the practice, focusing on overall better experience for the staff that's within the organization within our office. And then we have a clinical group who's responsible for the efficient operation of daily clinical practice needs, making sure all of the patients are room timely, assisting with office procedures, maintaining physician schedules. So those are just a few examples of teams and groups that operate within the practice that I work in at Spectrum Health. Thank you for viewing my presentation. I appreciate your time and look forward to your comments and questions. Thank you.